I'm very honored to present Cristina Magli from Bologna, embryologist, lab director, and the current chairperson of ESHRE, European Society of Human Reproduction and Embryology, and also to me, a friend or colleague for many years now. So Cristina, thank you so much for accepting to participate in this webinar. I really wish that you could actually have been with me here now in real. Yes. However, today when we say here, it doesn't any longer mean being beside you, but it means being on the same screen if we're lucky. So anyway, here we are. Welcome.
Thank you.
I was planning for this interview, and I was thinking that your chairmanship within ESHRE, it really turned out to be something completely different than any one of us would have imagined. But you're doing a really superb job, I think, and you've taken a very strong lead in this completely unbelievable situation. And I'm really, really impressed by what you're doing and how you're handling it all.
Thank you.
Anyway, I think we'll leave that part for a moment and focus on you and your person. So I would really like to tell me, everything from the beginning to the end, or to where we are now. And starting a bit about, how did you come to be an embryologist? Was it by chance, or was it sort of something you had to focus on from early on? And how did you come to work in Bologna?
Well, I am from Bologna, so this is my city, actually. How come that I became an embryologist? Well, totally by chance, because it was an ad in the newspaper many, many years ago. The point was that when I graduated in biological science here in Bologna, soon after that, I got married. You know my husband.
Yes.
He's a civil engineer, and actually he was born in Venezuela from Italian parents. So his genes are actually Italian, but nevertheless, we decided to go there because he had a working commitment over there. And Venezuela at that time, I'm talking about the 80s, early 80s. It was a very nice country where to live. It was a fantastic country. The Caribbean, I mean, I had there very, very nice moments. And then over there, I started working in the Venezuelan Institute for research, and I was involved in immunology. Immunology at that time was a real top area where everybody was so much interested in immune response and trying to understand how ESHRE antigens predisposed to in some sort of diseases or potentiate the immune response. So and there I did a lot of molecular biology. At that time I used to do PCR with 3 water baths, going from one bath to the other. And I have to say that the amplification bands were absolutely beautiful. Nevertheless, like everything, it came to an end, and we came back to Italy in 1990. And then I was actually without any special possibility of doing my job. I mean, I didn't have any special content, and there was 1 month later that I arrived to Italy, and there was an ad in the newspaper, and it was Luca Gianaroli, a name that for me was totally unknown, looking for a biologist. They didn't use the word embryologist, maybe, I don't know, I don't remember that. Anyway, I didn't even know what it was. And then so I went to see him, and since I had some publications coming from my studies in Venezuela, and I spoke a decent English, I convinced immediately that I was the right person. And this is how I started working with him. He is the one that taught me how to do IVF. I'm talking about the early days of IVF. So the
So which year was this?
1990.
1990. Yeah.
So it was conventional IVF, but I didn't have an idea, you know, about oocytes, spermatozoa, I mean embryos, and he taught me how to do it. He taught me how to struggle with partial zonal dissection, subzonal sperm injections, because ICSI was not there at the time. And then it was how I started, and I'm still here. Why? Everybody asked me that, because everybody that knows Luca knows that, you know, is a very strong character, very demanding person, absolutely demanding. But I don't know, we managed to share this experience together. I have to say that it gives to me a lot of liberty for doing research studies, and so I think
he must be a very inspiring person also. I mean, he has lots of ideas, he's very bright, and he lets you do all these things as well. So it's a
even too much
give and take.
But sometimes we would like to slow him down a little bit, because you know, of course he has a lot of ideas, but sometimes he doesn't have really the sense of how, practically speaking, this idea can become a reality. So sometimes if you don't do directly things in a routine way, you have no idea of how complicated it can be to put in practice some idea. So
he's a visionary. He's a visionary person. Really, I grew up with Lars Hamburger. That was the same thing. Exactly.
So yeah, definitely is that way. So this is how we came that after 30 years we are still sharing the same working place. That's it. That's it.
And when you think of when you became an embryologist and where you are now, was being a biologist in an IVF clinic or an embryologist, was it what you had imagined, or maybe you didn't really have any sort of expectations? How has it turned out? What's good, what's bad, what's changed during all these years?
The first day I was shocked. You know, since I don't like very much operating rooms. I mean, I don't like blood. I don't like, you know, it's something that I feel okay in the lab and not in the operating room. Maybe. So the first day it was something that I thought, no, I don't like it. But as soon as I started seeing the first oocyte, sperm, I was not really fascinated by sperm, but the first embryo, I was impressed. And then even nowadays, I still like embryos so much. And when I see a beautiful blastocyst, you know, one of those, or a morula, I like morula so much. I could spend hours looking at them. Well, hours is a little bit too much, but I mean, I really still like it. So it turned out to be a fascinating area for me almost immediately. So yes, it's something that I always say, if somebody would tell me, you have the possibility to start your life again, would you do the same? Would you change many things? And I always say I would exactly do the same, because I'm so happy with my job, with my activities, with my results. Of course, there are difficult moments, like in everything. But yes, no, I don't want to change anything in my life. That's perfect. I have good friends and good colleagues, and that's fantastic.
All over the world, yeah.
All over the world. Yes.
But if you look at what's changed during these 30 years, have things become better or more complicated, or how do you see what's changed, and for good and bad?
Yeah, there is one thing that I really miss. That is the enthusiasm that we had in the past. We gave more time to be happy when things went well, even a pregnancy, especially if in a particularly difficult patient was an occasion of being really happy. Sometimes we also used to take time for small celebration. I'm not talking about parties or movidas or so. I mean, you know, we were really enjoying positive things. Now I have the impression that this is not the same anymore. Now we are more concentrated on failures. So we maybe come together to investigate why things didn't work very well. And we forgot a little bit that it's not only the negative side of a situation, but I really miss that. I mean, being happy for things. I know that a pregnancy is a normal thing to occur in our job, but I mean, when everything is working well, why not to be happy for that? Something that I really miss a little bit. And of course, we have changed in a way. We have gained many other aspects, and I mean, the quality system, just to tell something that it didn't exist in the past. I remember so many times of being worked alone in the lab, no quality control, no a special quality control. That of course we were touching all the surfaces with our hands to be sure that they were more or less warm and so on. But, no witnessing, no, I mean, no the records, keeping records and so on. Of course, having an idea of the pregnancies and so on, it was important. But yeah, nowadays I couldn't work in a system without a quality control mechanism in place. But I also think that sometimes it is too much. And too much is not good, and too little is not good. The good, well, ancient Romans and Greek used to say, in medio stat virtus, the virtue is in the middle. So it's difficult to find which is the right balance between what is too much and what is too little. So quality is certainly something that an improvement in our system. I have the impression that sometimes it prevents a little bit from initiative,
absolutely,
innovation, and also some troubleshooting. If something happens and you have to find a solution, if it is not listed in your troubleshooting procedure, then I see that today people tend to say, it's not written anywhere, I don't know what to do. I mean,
no.
It seems to me that we lack a little bit of the, inventive initiative that we used to have in the past.
The common sense, I would say sometimes. I also had the same experience in my lab when someone said to me, but it doesn't say in the protocol. Well, you've been here for 25 years, think. Yeah, it takes a little bit of the initiative and the fun out of it. I agree, although it's very necessary, of course, to have all this quality. I also remember a common friend and another lab director, common friend to us, who said that it is interesting how when something goes wrong, you go through all these procedures to see what went wrong and what you did. But you never do the same when things go well. You never go through all your procedures to see why does it go so well. So as you were saying, sometimes you have to look both ways. I agree.
Yeah, we agree. As usual.
As usual, we always agree. 99%. Okay, so after having made a detour to Venezuela and then back to Bologna and stayed with Luca for so many years, how did you sort of get started in ESHRE? I think we were there, we started almost a bit at the same time. So which way did you sort of come into the ESHRE part of your career, so to say?
Well, again, it was because of Luca, because he was the one that started. I think that you said he was a visionary. He's a visionary person, and maybe he could see that. Just I'm a little bit immodest. I think it was saying that I had potential to grow, to develop, and then he started to bring me to all congresses and to introduce me to the key people in our discipline. And so it is how I met all the founders. So I cannot tell all the names because, of course, there are many. I would just maybe like to mention, of course, Bob Edwards. And I think that I'm also going to give a thought of Jacques Cohen. Do you wonder?
Never heard of him.
Do you wonder why? And you know what? When I also went, Lucas sent me to have a few days in New York at Cornell, where Jacques was working, starting to look at biopsies, that polar body biopsy. Jacques taught me how to do. Well, I learned it from Yuri Valinsky actually, but then I was there to see how he was working. And when I met Jacques, he told me, aha, working with Luca, I will be very nice with you. I have to give you the best. So this was, yeah, the introduction. But okay, apart of any joke, yes, one of the things that I learned from Luca was how to become fond of ESHRE. And being ESHRE for him was top priority. And I started to follow him and to be involved in the society. My first real commitment was in Berlin. I still remember the place and the room. It was in a pre-congress course of the special interest group Embryology. There was a debate between Stratis Kolibianakis and David Gardner on blastocyst transfer that was, my goodness, it was hot. They were, it was an unbelievable debate. But nevertheless, during the coffee break, Dominique Royer, that was the coordinator of embryology at that time, went to Luca, not to me, to Luca, and said, do you mind if I ask Cristina, your embryologist, to join the group? I mean, come on, ask me, not first. But nevertheless, then he said, of course, yes, yes, yes. And it was, I started to be a real embryologist. I mean, because I have to say that belonging to the SIG embryology changed my life completely. It was a fantastic experience. And when I was, when I became the coordinator of the SIG embryology, I mean, I was really flying high in the sky. It was something that I really enjoyed. We worked very hard, you know, because we were together in the steering committee. We worked really hard in the certification scheme, in promoting education. And we reached a point that I'm very, very proud of. Before my time as coordinator, the special interest group endocrinology was the most popular. And during my time, we overtook them. And now we are the most popular SIG or special interest group. And this was something really exciting. And then duty after duty, we came to a day in which we were, it was a November meeting in one of those internal ESHRE meeting. I was in a corridor of the hotel where we were having the meeting. And you, that were the chair at the time, approached me and asked me, I would like to propose you as a chair-elect of ESHRE. Would you like to accept? Of of course, my reaction was to say, okay, I have to talk to my boss, because of course it's a timing implication that is very important. So I have to talk to him. But believe me, I was I was jumping like a kangaroo. I was so excited, was so happy, although I was totally sure that it was not going to be possible, because I thought, you know, two Italians coming from the same city and from the same center. Very difficult to happen. But then it was, I think that people in ESHRE didn't consider that this was a negative point, and at the end I was appointed, and now I became chair of the society. That is a tremendous honor. I mean, something that if I think of the names that were before me, and I can still believe that this happened. We have that fantastic role that I think it's one of the winning points in our society, of having this alternation as chairperson between clinicians and scientists. And I think this is such a strong message given, because our discipline is the real demonstration or example of a close collaboration. We cannot exist without clinicians, but clinicians cannot exist without scientists. So I think that this is something that really reflected how ESHRE was created, but resulted to be at the end the real extra point in advantage to our society compared to many others. So
I think it's been a win-win, and the good thing is that you have people, when you are the chair, you have one of the other sort of discipline on your sides to help out with questions that maybe you need to. You work in a very sort of efficient way of helping each other all the way through. It's very effective, I think.
Yeah.
So, it's nice. So now you're there, and as I said, what you're working with now is, of course, not really the things that you were hoping to work with, because you have to concentrate so much on what's happening around in the world now. But otherwise, if we don't go back to the pandemic right yet, so what were your aspirations when you started as a chair? Because, I mean, first you had 2 years as a chair-elect, as we always have, so you have time to sort of see what's happening and what's going on and what you would like to do. So what were you thinking of when you started that you would really like to concentrate on and to change or make more efficient or whatever? Did you have any special way that you wanted to go?
Yeah, well, you know as much as I know, the way ESHRE leadership is working. So the chair is certainly the main responsibility, but we normally work as 3 people, because there is the chair, the past chair, and the chair-elect. So this is a very good point, because, well, first of all, we are not alone, and the chair is not alone. I mean, you can all the time discuss, and talking to the others helps a lot, because it helps to clarify your mind, to have additional ideas, additional comments, points that you didn't maybe consider. So this is very good. And the other point that it provides continuity. Because of course now I have Roy Farquharson, that is the past chair, that is like my dad in this case. I mean, when I need some, some experience or some memory, this is behind me. And now we are training our chair-elect, that is Carlos Callas, to be ready to take over in 1 year. So this is a very good system. And I say this just to make it clear that when I started my term, I had already in mind, because we developed that together, what the future plan would be in the coming years. You know that we have started a couple of years ago in revisiting our mission. So we decided, okay, we are a growing society. We are in a world that is changing dramatically, very fast changing. And in some way, we have to verify if we are keeping the pace of the developing world. So we started to revisit our mission to make it in line with the today's world, with new situations, new realities. And then we decided to focus on, to develop some strategic objectives. Yeah. And this is something that I had very clear in my mind. I mean, because it is a sort of continuous, it's not that a chair comes and then decides to make a revolution of the situation. I mean, we are typically European, I think. So we are very organized, and I try to, you know, develop things in a proper way, in a very consolidated, how can I say? So we have developed these strategic objectives, and these were the plan. This was the plan to follow. Several points, but I can just mention a few of them. Of course, education, it's our main target, our main, sorry, our main duty. And I would say that we are very good at it, but we have to certainly improve our way of transmitting education, and also considering that the new realities of these new people that is coming. I mean, as we were not used to be to have around so many people from India, from China, from the Far East. So, I mean, the situation is changing. So we consider how to include or how to modify our education system, where there are some aspects that are extremely important, and I think we are very good at that. That is, for example, the programs of certification and the guidelines. Another aspect that we decided to give a special emphasis was research and innovation. Our work is research. I mean, the more research we do, good research we do, and the more we can learn about the process of the physiology of reproduction, the biology of embryogenesis, oogenesis, gametogenesis, and so on. So, and the more we learn without our personal pleasure of knowing more and more, it also can also be translated in something positive for our patients. So, and for this reason, we decided to focus especially on that, and we actually are promoting research by creating these research grants that we are giving to support ideas and good projects that need some sort of economic help to be able to turn. And another special aspect that we decided to potentiate very strongly is the collaboration with policymakers. We are really now very much involved with the European Commission, with the G-Santé, I mean the group that is involved taking care of the human application of cells, tissue and cells, which we are involved in. And I think that we are extremely proud of saying that after so much effort and so much work, we are very close to be the point of reference for the European authorities in matters of reproduction, reproductive medicine. This has not been easy. We have decided to push this very strongly, and I think that we are now in a very, very good position. One of our main target won't be easy to develop, but is certainly to potentiate our registry, because of course data collection is something that can really help us in understanding how the consequences of our techniques, of our approaches in reproduction, in reproductive medicine is going to end. I mean, is it successful or is not? I mean, so the follow-up of pregnancies and baby borns is something that is very much in our mind. So I hope, and these were certainly among the most important points that we were working with. Unfortunately, or anyway, even without unfortunately, this happened, so we have to cope with it. We had this sort of break that is represented by the pandemic, for which we had to a little bit rearrange the priorities and our schedule. But yeah, I think that we are now going back to normal little by little. Maybe we are also becoming used to this new way of approaching things, and yeah.
So do you think that this pandemic situation, do you think it has and will change our attitudes also in the long run for ART? I'm thinking in my own clinic, for example, where now I'm working in a hospital where we are very much behind, and it's a huge hospital in IT, and everything takes ages and ages. And we've been working with trying to make, more video meetings, consulting meetings online, for example, for years. Now, in 3 weeks, we're doing it all. So some things are moving very, very fast now due to this crisis. And so, I mean, some good things will hopefully come out in the end, at least. So could you see, or do you have any ideas for ART, if some things will really change to this? Will we be more careful with something? Will we have different technologies coming out, or different ways of working with our patients in the future?
Yeah, I think so. Talking between us embryologists, we have to say that we didn't have to change that much in our daily practice. I mean, from the laboratory door inside, the situation didn't change that much. But of course, it changed outside. Certainly, the patient management is different nowadays. But not only that, one thing that I think is extremely important is also our behavior as persons. I mean, when we go out of the clinic or the hospital or wherever we work, we need to follow a code of conduct, because we now have a very strong responsibility, not only as citizens, generally speaking, but also as practitioners, because, I mean, if we are infected by the virus, and if we bring the virus inside the clinic, of course, it will be a tremendous difficulty for the whole clinic. And we do not know what is going to happen if we bring the virus in the laboratory. I'm not a virologist. I don't think, for what I know, that would be the risk of transmitting from an infected embryologist, let's say that maybe an healthy carrier. I don't think that there will be the risk, the way we work, of infecting cultures, our culture, the culture of the embryos. I don't think so. But since we do not know, of course, we have to be very cautious. And yeah, I think yeah, we are now extremely careful. In Italy, we suffered very much of the pandemic. We were the first country, European country, in experiencing that. We were sort of the guinea pigs. I had the impression that the other countries didn't take this very seriously because maybe they thought it was, okay, something that happened to Italians, but you know how Italians are. I mean, you can never trust them, it's their problem. They don't know how to behave, how to blah, 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 blah. But nowadays it results that the problem is really very big. So yes, I think that strictly speaking about our work in the clinic, yeah, things will change. Will change.
So,
that sense of preserving social distancing, having everybody with the mask, with the fashion mask, and you know, and this feeling of washing hands continuously is something that will remain.
Some of it will stay, I'm sure. Yeah.
Yes.
I have one last question for you, Cristina, and that is going back a bit more to embryology. How would you see embryology changing in the future? Looking at, I mean, so much technology coming in, for example. What will be our role in the future? Not you and me, maybe, because we will be gone by then, maybe, but or not in the lab anymore, hopefully. But how do you see the embryologist's role? I have this slide sometimes where I end talks when I talk about the lab. It's on Homer Simpson, and he sits in his job with his feet on all the machines and just eating a donut and just supervising everything on the screens. Is that what it's going to be for us, you think?
And what happens if the machine fails?
I don't know. I didn't come to that slide.
You know, I know that artificial intelligence is coming, well, it's already there. I think it will bring a revolution. I mean, everything, all technological advances are going so fast, my goodness. And that's really impressive. But it's also true that I keep thinking that our brain is still needed, will still be needed, even when the artificial intelligence will tell us, you know, this is the way it has to go. But then if you make a sort of consideration, a calculation that only a human brain can make, and bringing back that common sense that you were talking about before. And maybe that you realize, oh no, this is the wrong setting of the machine. This is something that is not possible. I still think that there is room for us. So I really don't think maybe we won't do ICSI anymore. I mean, physically. Maybe we won't do vitrification anymore. Already there are possibilities of all this stuff, but yeah, but still the capacity of connecting information, making conclusions, and establishing correlations. Well, I still have to see the machine that will be able to do that instead of
and also because we're working with humans and they are not the same. So one patient will be very different from the next and from the next and from the next. So we always have to make these calculations between what's best for this one and this one and this one. And maybe that, hopefully, that will still be up to us.
Yes, absolutely. I mean, there is, you know, when you put together many data, you know, and you have to analyze them and make comparisons or correlations, then you bring your data to the statistician, and then he said, okay, I'm going to normalize for this variable, this variable, that variable, the other variable, and then this is the conclusion. And then if I ask him, but if you normalize for some other stuff, do your results change? Of course, with statistics, you can do whatever you want.
So we have to think.
So yeah, of course, I mean, I guess that in 10 years, everything will be very much different. What is also changing a lot is the social reality. I mean, it's sociological changes. I mean, people is now coming to us asking for things that are completely different from the past, because we have more and more things to offer. I mean, simple examples are social freezing is a novelty, but I mean, more and more people is now asking for social freezing, and this has consequences. This has important consequences. So, and beside that, I mean, genetic testing, and you know, there are many things that have become a sort of sociological behavior.
Yeah, it's a different society all the way, and different constellations of families wanting to have children as well, and so on. So. Okay, thank you so much, Cristina, for this. Excellent, great. And I do hope that we will soon meet in real life. I miss you.
Certainly, we will meet in the virtual annual meeting of ESHRE.
Yeah, but that's not the real life.
It's not the real life.
It will be almost like real life, we hope.
But it is the reality.
Yes, it is the reality, absolutely.
Yeah. So I hope to see everybody there, because it has been a difficult decision to make this change. But as I thought from the beginning, we have two possibilities. Either we stay here in full depression, thinking, oh my goodness, what happened to me? Why to me? Why to me? Why now? Or we react and we take the bull by the horns and start try to find a way out. And this is what we decided to do. So I think that we will be in the winning part of the situation. So this will be a very good meeting. Then, of course, I really miss you all. I really would like to sit next to you and you know, drink a glass of wine. Can I say that?
That will be for next time.
A glass of wine. That is very healthy. It's a Mediterranean diet, so that's good. So I really miss you all. I hope that we can meet very soon.
Yeah.
In the very near future.
So good luck with our annual virtual meeting. It will be very, very interesting. Very interesting. So
it will be.
I heard a lot of people registered already, so great.
Yes, it's great.
Okay, take care. Thank you.
Bye. Bye.